looks like we are at 6:30. Wow, lots of faces on here. Well, my name is Tara Roddick, and I am a child care consultant supervisor, and I supervise Dubuque, Bramer, Butler, Franklin, and Grundy counties in Region 2. We do have lots of child care consultants on who take care of all of you throughout our 19 counties in Region 2. I first want to just welcome you and express my deep gratitude for all that you continue to do for the children of Iowa and specifically for Region 2. We really appreciate what you're going through, and we know that you are on the front lines and you are essential. And we know that if it wasn't for childcare providers, then things would not continue to run like they are. I do want to share, I did say the chat box is to your right. I will be facilitating through the evening. We have different people who will be talking. I have 4 cats and a dog, so if they pop up in the back, I apologize. There's not a whole lot I can do about that. But I did want to welcome you all, and you know, we just wanted to make sure that we could get some information out to you, have an opportunity for you to ask questions if there are specific questions, especially for one of our nurse consultants who will be presenting in a little bit. We know that the health and safety part of the pandemic is probably what weighs most on your minds as you have little ones come, as you have parents who begin to socialize on the weekends more than they have. So, you know, Kim's going to go through guidelines and where to find a lot of stuff. So look forward to hearing from her. I'm going to go ahead and pass it to Brenda Loop. She can introduce herself and then share some information.
Hi, everybody. It's nice to see some faces. So I don't get to go out and do visits like a lot of our staff do. So you probably know me from all the emails that you get from me. I'm the data specialist, so I am responsible for that. And I also am good with technology, so I'm on a lot of these sessions to help people. So if you're having any difficulties with anything, I see Beth, you're nodding your head. She's one of our staff. I help her too. So feel free to put something in the chat, and you can send a chat just to me if you would like to, if you're having difficulties. Things are set up a little differently if you're on an iPad or a phone than if you're on a computer. So feel free to reach out if you have questions. The other thing I just wanted to mention briefly is everybody's capacity to take children right now is a little different. So some programs are open to enrolling new children on a temporary basis and some aren't. So we've been in contact with all our childcare programs much more frequently, which you've probably noticed. So we just wanted to put this out there that if you are at the capacity that you want to be and you get contacted from parents that are looking for care, you can send them to our website or have them call our referral number, and we will put those in the chat. We do have programs throughout our 19 counties that have openings for children. So don't feel like you need to enroll additional kids if you're really just not ready to do that. So that's in the chat. And also just keep us updated as things change with the openings at your program. We are providing information on a daily basis that's going out on a map that you may have seen for the state of Iowa. We're actually doing 2 maps now. One's in Iowa, one's at the national level. But that information is being put out daily. So as your openings change, just feel free to either let your consultant know or let me know directly. Either way is fine. All the consultants just forward those things on to me. So unless somebody has any questions for me, I am going to mute myself and we will keep going on with the agenda.
Okay, thank you, Brenda. The next section, what I forgot to add in the beginning also is all of Region 2 childcare providers who have been open through the pandemic. We have signs for your yards, and some of them are showing up. So if you get one all of a sudden outside of your house, it came from us. I know some are still being delivered. It's quite the process to deliver for 19 counties. So keep an eye out for those. You can put them in your yard if you want. You can put them in your childcare, wherever you choose. It's a little gift from us, saying that you are our heroes, and you are really the workforce behind the workforce. So thank you very much. I forgot to add that in the beginning. Another thing I want to touch on just briefly is I was in a training and we were talking about trauma, and it got us thinking about what we're all experiencing right now. You have children in your care who have maybe been home with mom and dad or grandma and grandpa, not in school. And so when they're coming back to your childcare, they're coming back with different experiences. And they may see this as trauma, what they're going through. And so we have to be aware of behaviors that could happen when children come back to the childcare. They might not be quote unquote the same children as when they left, because they've been through an experience. We all are going through this experience. Maybe someone has lost a job at home. Maybe things are hard at home. We also know that childcare abuse rates are down. It's because our children aren't in their safe spaces anymore. And so as children come back to school and to childcare, we might all be experiencing more of that. So my message to you and staff too, if you have a co-provider, parents, it's just something to be aware of. So my advice to you is to give them some grace. These children, challenging behaviors, maybe they didn't have any before, and maybe there are some when they come back. That adjustment period is going to be for all of us. I mean, lots of us sitting here as consultants are working in our home. And so going back into the office or going back into visits, things are going to feel a little scary sometimes. And just think how that is with the children. So I encourage you to reach out to your consultants for resources. I encourage you to maybe review your mandatory reporting and make sure that you are aware of how to call. I'm not saying there's going to be a spike in your home, but these are things that we might see more of, and we're just being real about it, that children are leaving a not safe, could be leaving a not safe place and coming to you. So that is a little heavy, I know, but it is important, I think, to give grace to these children when they come back and make sure they continue to be in that safe space and know that you're there as a constant for them, which you always have been. Okay, we're going to totally shift gears now, and I'm going to pass it off to Terry Orr, and she's going to talk to you a little about virtual visits.
Hey, good evening, everybody. It's nice to see some familiar faces on here and see everybody after a nice long weekend. So something that we were really kind of working on is something called virtual visits. I know a lot of you are still needing support, and we really want to offer that support, but it's going to look a little bit different for a while. Virtual visit is just that. It's just doing a visit over the computer or your iPhone or an iPad or a tablet or whatever you have. It's just another way to kind of get some of that information to you, be able to see you, talk to you. We do have a platform called Microsoft Teams that we can send you the link, and it's pretty easy to use. And that way we can see each other. We can also share documents with you, and we could still kind of do that visits without being there in person and making sure that we're offering a safe and efficient way to do some services. So we're going to really make sure that you're comfortable with this before we do that. We're just not going to send you an email and say, hey, by the way, today at 1 o'clock, we're doing a virtual visit and spring it on you. We'll definitely work with you on this. If you're not comfortable with that, we'll maybe hold off on as long as we can. But there's some really good opportunities for us to be able to connect with you this way. Maybe some of you are maybe a little bit more comfortable doing a virtual visit, and that would be a good opportunity for you as well. So just look for those things to come with your consultant, and we'll be kind of maybe reaching out to some of you soon to be doing some of those things. We'll definitely kind of address any confidentiality and privacy beforehand to make sure that there's nothing that's going to pop up. And we'll kind of do the same type of things we did before. We'll make sure to summarize at the end, send you information. We'll make sure that all the information is clear to you and understandable. So we are excited to do this. We're happy that this is another way to provide some additional services to you. Be open. We're learning just as you are. Everything's so brand new that we're hoping that you'll be willing to try this out with us coming soon. So we will we'll hear more as the things pop up. Thanks, Tara.
Okay, thank you, Terry. Next, we are going to I'm just going to briefly remind everyone about the CARES Act for childcare providers that came out, I don't know, about 2 weeks ago, maybe now, week and a half. And just you hopefully are getting contacted by your consultant, or you should have received an email in regards to the CARES Act. And what it was, just a reminder, there are rejuvenation grants for those who have had to close because of COVID-19. So there is a stipend there or grant there to help you with reopening and cleaning supplies. For those who have remained open, there is an April and a May stipend. You do have to apply for each individually. When you go to the website, it does say April survey and May survey. Those are the actual applications. And then there is also a stipend if you have been giving a discount for essential workers, a 25% or more discount. So if you have questions specifically on this, please contact your childcare consultant at CCR&R. We have been trying to contact everyone. As I've mentioned before, there's a lot of providers, but if you are interested, please reach out. The deadline is the end of this week, or the 31st. We're not positive if it's Friday or the actual 31st, but please reach out. Brenda has put the link in the chat box, so you can go to the link. If you need help filling anything out, please contact your CCR&R rep, and we will be happy to help you with that. There's a lot on tonight, so if we get specific questions, we can work on that. But just wanted to make sure everyone is knowledgeable about that and know that where you might be eligible. We also did receive a new DHS guidance last week on childcare providers. Just a reminder about cleaning and those type of things. So look for that. If for any reason you miss any of our emails, or you're like, I don't know if I got the most recent one, you can go to our website, which Brenda added to the chat, and they're all logged there on the very front page. And it's from newest to oldest. And so you can go on there and make sure that you have seen everything. But the CARES Act, that's a big one. We want to make sure if you're eligible that you apply. We do get notification. We're getting notification about weekly on who applied. We don't know who actually is approved necessarily, but we can reach out if we're seeing something. There will be, oh great, Brenda says only the April and May ones are due May 31st. There will be a new survey for June and July. So thank you, Brenda. Like I said, questions about that, contact your consultant directly. If for some reason you're not sure who your consultant is, you can pop Brenda an email, she's here, or you can just email the regular, the general email, which is, Brenda is going to put it in the chat box. Okay, that is a lot of talking from Tara. So I am going to now turn it over to Kim Gonzales, and I think she's going to share her screen. Like I said, health and safety, I know that's on your mind, and I know Kim will give you some good information. And then if you have questions as it goes, please put into the chat box and we will address those. Thank you. Kim, you're muted. You have to unmute yourself. There you go.
Okay, we're all new with this technology, right, Tara? We had our 2-hour class, we got through it. So hopefully we'll get through this tonight too. So again, good evening. Thank you everyone for taking time out of your evening to attend this tonight. Hopefully you'll gain some good information. I have a lot of good information. I'm gonna go ahead and start sharing my screen. So I'm gonna go ahead and take my video off for now. And then I'm just gonna go over a few things as I'm getting this going here. I just want to thank each and every one of you, just like Tara did earlier, for everything that you've been doing to help keep the children that you're caring for healthy and safe during this pandemic. This is really something that no one would ever expect this to happen, and we're all living through this right now currently. So I know it hasn't been an easy journey for any of us, and especially you as a provider. I know you had to make a lot of sacrifices during this time, and you had to have probably already make some hard decisions that you had to make in regards to serving your families and whatnot. So I really do appreciate everything that you've been doing. Every day I do I am very thankful that we have such great providers in Region 2. You guys are awesome, and as like Tara said, you are serving the people that are going to work, the nurses, the doctors, the EMS, grocery store workers. So without you, our community would not be working at its full capacity. So thank you for everything that you're doing on a daily basis. And so tonight I'm going to go ahead and share. I'm going to go ahead and get into the PowerPoint here. Just give me a minute here to get this going. So again, just a word of thanks. I think you all are amazing. And again, I don't know what we would do without you. So I appreciate you, and everybody else, all of our consultants appreciate you as well as I'm sure your families do. So we're just going to go ahead. This is Heidi Hotvet. She is our childcare nurse consultant. She's our Healthy Childcare Iowa coordinator. If you've met her before, she gives all of us nurse consultants our guidance, and this is her contact information. I would have you take note, if you haven't already visited, we're going to go ahead and look at the Healthy Childcare Iowa website. If you haven't already visited, I would encourage you to go to that website, because most of the resources you're going to find that are helpful are going to be on the Healthy Childcare Iowa website. And that is available at that website right below. And then on our printed resources page, that's where you're going to find most of the COVID-19 information. So you'll get to that page, and then you're going to scroll, you'll go to printed products, and you'll scroll down. So that is a really good website. I don't have a picture of me, but I like flowers, so that's what I put up there tonight. So I couldn't find a quick picture, and you see me already. So my name is Kim Gonzales. I am with the Visiting Nurse Association. I am a nurse consultant as well for Dubuque County, and that is my contact information. I did see Darla Butekoffer is also on. She is our nurse consultant in the northern region, and also Monica up in Mason City area. And I'll go over those counties as well. We'll have that slide at the end if you're not sure who your nurse consultant is, so we'll go over that as well. And that is my contact information. We're just going to look at a quick overview of COVID-19. We all have kind of learned as we are going along what COVID-19 is. As we all know, anyone can get COVID-19, and anyone can have mild to severe symptoms. So a lot of times older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness. Some of the symptoms that you may see that are pretty typical is a cough, shortness of breath, or difficult breathing, and fever is also another very common symptom of COVID-19. With this, there's information available. Many of you, if you're opening or if you've been open during this pandemic, there are some guidance documents for reopening. So if you are coming back into business, there are some documents that are available, and that would be on the Healthy Childcare Iowa website. So again, we'll hopefully be able to look at that later. If you wrote that down, you can check that out at your leisure as well. And alongside with that, there's a lot of different documents that are going to be there. And again, it's a lot of information. And I just want to preface it again, things change on a day-to-day basis. Just like Tara was saying, that we are learning things as we go as well. So what we say today or this week may change next week. So just always try to stay in tune and keep informed with all the changes. I know it's hard and it's difficult. And again, utilizing these websites and contacting your consultants is your best way of staying informed. So we're going to look at some guidance when there's a potential or confirmed positive COVID-19 staff or child. And then your local CCNC and local public health department will help guide you through this information. We as nurse consultants cannot tell you that you have to close your business. That's one thing that we are not able to do. But if you contact your local public health department, they might have some different guidance that they can help you with in regards to that. So we can always guide you to that, your local public health department as needed. Here is one of the documents that is on the CDC's website, and it's also on the Healthy Childcare Iowa website. We just link everything, so it makes it easy for you, so you don't have to go searching, because I know as myself, it takes a long time to do a lot of research, and so a lot of these documents are changing or they're very hard to find. So again, Healthy Childcare Iowa's website is linked to all these documents, so that makes it easy for you to just kind of find those right away. So this is a good guidance document for childcare programs that are considering reopening, and just kind of those guidances that you need to meet to see if you're ready to reopen. So again, that's going to be linked, and you can look at that more in depth. I won't go over it all. There's a lot of information as I'm sharing tonight, so I just would encourage you to take time to print it and read it. And if you do have questions, please contact us. We would be happy to help you with that. So the Centers for Disease Control, which is CDC at the federal level, that guidance is available also for programs that remain open. And so they give a lot of different examples on how to do different best practices. One of the things that they do talk about is if you're doing temperature monitoring, there's some guidance on that, how to do that. They do recommend, if you're able to, and I know in a home it's a lot more difficult in some aspects versus maybe a center. Some of these things could maybe be done in your home, and other things maybe you're just not able to do. But some of the things, an example that they give, I'll just give you an example. Like when you're taking a temperature, is to stand behind a physical barrier such as a glass or plastic window or partition that can serve to protect the staff member's face and mucous membranes from respiratory droplets that may be produced if the child being screened sneezes, coughs, or talks. And you always want to make sure that might not be something that you could do in a home. Think about how you can protect yourself, make sure that you have your proper PPE. And during this time when you're doing temperatures, how can you make sure that you're best protected? Always make sure that you're doing a visual inspection of the child for any illness, which could include flushed cheeks, rapid breathing, or difficulty breathing. If they haven't had recent physical activity, they could be, if they're fatigued or if they're extremely fussy. You want to conduct temperature screenings, and most of you should be doing that at this point, because that is something that DHS does want you to be doing. So that would be something that you need to be doing. And if you're doing those correctly, make sure that you're performing hand hygiene, and then making sure that you're wearing gloves. Check the child's temperature if you're using a partition, or if you're not, making sure that you're staying as safe as possible. And then if you're using a thermometer that you need to clean, make sure that you're disinfecting it after each use and washing your hands, or using hand sanitizer as well. So those are important things to keep in mind as you're doing your health and safety checks when children are coming in. Cloth face coverings, that is something that you can consider to use as a provider. Maybe that is something you're already doing. If not, you can always consider to use that. Sometimes programs for like homes, it might be a little bit easier. Maybe, that is another way that you can help prevent spread of the illness. With children, just make sure that you are not using face coverings for children under 2. That would not be appropriate. If you do use face coverings, make sure that you think about how you're going to launder them, making sure that the children are not touching them. All those things that come along with using face coverings, you want to make sure that you're using them appropriately. And so that would be something that you would have to think about if you're going to use face coverings for children, how will you, what would your procedure be? And are you going to send them home at night? Are you going to wash them in your home? You know, you would have to take them off when you're eating. How are you going to store them? So there's a lot of things to consider, and there is guidance on CDC as well for that. So I would encourage you, if you're wanting to use face covering, that would be something that you'd want to definitely get some information on that, or you can call your nurse consultant. Also on CDC, there is guidance on cleaning, sanitizing, and disinfecting. If you haven't had a chance to look at that, I would encourage you to go ahead and look at that. There's a lot of good information. That is something that is very important, not only this time, but any other time is when you're providing care. So that would be very important. And then if you do have a child that becomes ill, make sure that you isolate that child. And then, of course, you need to call the parent as soon as possible, making sure that, you know, the parent comes and picks the child up as soon as possible. So you want to have an isolation spot for that child if they do become ill at care. So some things that have happened just recently, and you probably heard of this already, or maybe you haven't, things are changing so quickly. I know even myself, I don't have time to watch a lot of the governor's updates. So I'm learning new things as we go as well. So there's so much information out there, but this is something that just came up and on May 14th. There was a health alert for physicians regarding information on severe cases of recently reported multi-system inflammatory syndrome in children, which is called MIS-C, associated with COVID-19. It is currently unknown if the multi-system inflammatory syndrome associated, is specific to children, or if it also occurs in adults. So they're not really sure at this time. They don't know a whole lot about it, but this is something that they've seen. It's rare. There is limited information currently at this time about it. Its risk factors, its pathogenesis, its clinical course, and treatments for this condition. So we're learning more as we go on that. So that is something that is out there that they have seen. So just kind of so you're aware of that. The CDC is requesting healthcare providers report suspected cases to public health authorities to better characterize this newly recognized condition in the pediatric population. So we're gathering more information as we know more about that, and more will be shared if we do find out more information on that. So again, it's a severe illness with multi-system organ involvement in a hospitalized individual 21 years of age or younger. And at this time, we don't have any additional information for providers, and the guidance has remained the same. And as you can see here, that children and staff should be excluded from care if they have a fever of 100.4 or higher, no matter what the cause of the fever is, okay? No one should enter the child care facility if they currently have symptoms of COVID-19, which includes fever, cough, shortness of breath, or have been around anyone with a confirmed COVID-19 diagnosis in the last 14 days. And CDC recommends 14 days of quarantine after exposure based on the time it takes to develop illness if infected. And that could be any time between 2 days after exposure. They say that people that have COVID-19 are infectious 2 days prior to displaying symptoms. And of course, we've also seen people that are asymptomatic or without symptoms. So it can take anywhere between 2 days after exposure all the way up to 14. Usually around 11 days is when you usually see symptoms occurring. So that's important to know and to note. And that information will also be shared on Healthy Childcare Iowa's website. It is a document that is what to do if you're sick, and that is something that we encourage you and recommend you to follow for that. So the information here is, as I mentioned, the products download section. If you go to their our website, Healthy Childcare Iowa's website, you can see the reopening guidance is over to your right. The decision tree that I showed you is there, and then the reopening guidance for cleaning and sanitizing for the childcare programs that remain open if you're one of the businesses that are open still. And then IDPH also has a reopening guidance, and they are basing that off of CDC's and then as the White House reopening guidance as well. So there's a lot of different information documents out there. So, but that should link you right to it so you don't have to do any of the searching. And then under the health and safety concerns, the COVID-19 exposure, you can see there is a child care centers and homes health and safety document. This is something that I encourage you to take a look at in case you do have a positive case of COVID in your child care setting. That kind of gives you some good guidance on whether it would be indicated that you would consider to close, and giving you some guidance there as well. So at this time, there is no state proclamation that child care has to close. It depends on your local public health department again. So that would be something I encourage you to talk to your local child care nurse consultant to get more information on that and get some guidance to kind of help talk you through that, whether that is something that's in your best interest to close. And then the CDC cleaning and disinfecting your facility when someone's sick. Also the what to do if you're sick is also linked there as well. And again, the website is up on top. One of the things that I want to just kind of share too is that we all need to kind of keep in mind that we need to remember to care for yourselves or for yourself, and we need to care for us. This has been very stressful, and a lot of people have experienced much anxiety during this time. You may be one of those people, or maybe you know a loved one or friend that has had a lot of stress and anxiety during this time. And I think we just need to all just kind of think about that. We've been through this. This basically started to go into effect, if I'm remembering correctly, right about the time spring break was going into effect. I mean, we had cases. It started back in January, but I think we were really feeling the full effect right around the end of March. So we've been going through this right now, if you think about it, almost, 2-3 months now. So here's some information on if you're dealing with anxiety, with stress, if you have children, how you can help them. Healthy Childcare Iowa also has information on how to help your children. I know Tara had mentioned that as they come back into care, some of the things that, you know, as a provider that we need to help them with. And then if you have any family, friends, or yourself, make sure that you're taking care of yourself. And so those are some of the ideas and suggestions. If you are in need of talking with somebody, please reach out. And then also utilize the talk lines that are available. This is from SAMHSA, which is the Substance Abuse and Mental Health Services Administration through the federal government. They also have a disaster distress hotline, which a lot of things, and I just kind of wanted to review this real quick too. Some of the things that you may see when you're dealing with stress, especially in this situation with COVID-19. Some of the things are typical reactions that you may see is anxiety, worry, or fear related to your own health status or others. You may have concerns about being able to care effectively for your children or others that you care for or in your care. You may be feeling uncertainty or frustration about how long you will need to remain in this situation and uncertainty about the future. You may be experiencing, or a loved one may be experiencing, loneliness associated with feeling cut off from the world and from loved ones. You may be experiencing anger if you think you were exposed to the disease because of others' negligence. You also may have boredom and frustration because you may not be able to work or engage in regular day-to-day activities. There's also feelings of uncertainty or ambivalence about the situation, and you may, or somebody that you love, may have a desire to use alcohol or drugs to help cope through the situation. Sometimes we also may have symptoms of depression, and those could be feelings of hopelessness, change in appetite, or sleeping too little or too much. And then some people also have post-traumatic stress disorder. And so if you are feeling any of these symptoms, or if a loved one or a family member, friend has had these reactions, for over 2 to 4 weeks, 2 to 4 weeks or more, I really recommend that you contact your healthcare provider, because these need to be addressed with your healthcare provider. So I just wanted to bring that up, because a lot of times we don't really talk about this, and I do think it's a really good resource here. So I know I have some close family members and friends that have experienced, even myself, some of these things. So this is real, and we are experiencing some of these things. Maybe you're experiencing a few, maybe you're not experiencing quite as many as the next person, but it is out there. So I just wanted to talk a little bit about that. So again, that hotline is available, and you can also chat. You can text that number down below, right on the bottom of the page there. So just wanted to bring that up and share that as well. Here is our counties for Region 2. I have 11, which is not our counties in Region 2, I don't believe, but our nurse consultants are listed below, and you can see what counties they cover and their contact information. So Darla covers Almaquee, Clayton, Chickasaw, Delaware, Fayette, Howard, and Winneshiek, and her contact information is there. And Diane Hoffman and Maureen Stockdale are in Blackhawk. Diane covers Blackhawk, and Maureen covers Bremer, Buchanan, and Grundy, and their contact information is also included. Myself, I cover Dubuque County, and Monica is covering Butler, Cerro Gordo, Franklin, Hancock, Worth, Floyd, and Mitchell, and her contact information is also available. So we can go ahead and go to questions. I can try to share my screen with the what to do if you're sick document. I'm going to try to do that right now. If you want to give me 1 second. Does anybody have any questions? If you do, you can write them in the chat. If you have specific questions in regards to a certain situation, I would encourage you to go ahead and contact your nurse consultants to talk through those. But if you have general questions, I can try to answer those.
Kim, I'm not seeing any in the chat box right now. If you aren't comfortable with the chat box, you can always raise your hand and we can unmute you if you have a specific or a health and safety question for Kim.
Everybody's quiet. I know there's a lot of information. Are you able to see my screen with what to do if you are ill, Sarah?
Not quite yet, but I know the last time when you shared it just took a little minute to come up. So maybe just because I don't see your pretty face, so maybe it's coming up.
Okay, 1 second. Let's see.
Okay. Yep, it's coming now. So there you go.
Which one? Right here? You see
Yep.
that?
Yep,
Okay.
we can see that now. We can see your screen.
Okay, so this is the document that I encourage you to download. And then again, it is linked through the Healthy Childcare Iowa website. And this just kind of goes over all that guidance that is in one spot. So it also talks about your cloth covering and monitoring symptoms. It also talks about, and it's pretty generalized because there's a lot more information on CDC, but this kind of tells how to discontinue home isolation, and then it tells you exactly what needs to be met. Okay, so you've had no fever for at least 72 hours. That is 3 full days of no fever without the use of medication that reduces fever, and other symptoms have improved. For example, when your cough or shortness of breath has improved, and at least 10 days have passed since your symptoms first appeared. So this information I think is really good to share with your families, to let them know this is the guidance from CDC, and IDPH also links their information to this. So, you know, to let them know in advance that there could be a potential that their child would be out for 10 days, so they can make other arrangements. I know you guys have done, you know, have talked to your parents and shared your policies and procedures, but I think to kind of let the parents know that this might be something that they might need to have a longer term plan. And so then they know in advance so they can prepare for that. So this is the document that is, I think, is really important to make sure that you have that. Any other questions or?
I am not.
How about,
Go ahead.
sorry.
It was just me. Go ahead.
How about any of the other nurse consultants, Darla or Monica, anything else that you would like to share for your community? Or I can't see everybody, but I think they're still on.
I can't think of anything else right now, Kim.
Okay.
I am wondering if there is, I know for Dubuque, there's some providers who are on who have stayed open. I'm wondering if any of you would want to share how you are doing like the drop-offs with the temperature check. I'm not going to call anyone out, but if you're willing to share how that's been going, maybe you could just raise your hand and Brenda can unmute you.
Anybody can actually unmute themselves. So if
Okay.
you share, it looks like Katie, you
Katie,
can.
yep.
If you can't unmute yourself, give
I
me.
just did it, I
sign.
think.
Okay. Yep, I hear you.
I haven't really had any issues, but the parents don't come in the door. I take the child and then I check their temperature first. And if their temperature passes, then the parents just go ahead and take off. And then I take them into the bathroom and we wash hands. And pretty much the rest of the day is as normal. I don't bring attention to COVID with the little kids or anything like that. I did add other temperature checks, so I take their temperature every couple of hours. I've been lucky so far, and I haven't had anybody with a cough or anything like that. No fevers, haven't even had any sick kiddos at all. I do kind of have a question. I know there's a lot of providers that are not accepting kiddos with a cough at all. Is that what we should be doing?
Right now, they really recommend that you follow the guidance that CDC has put out with the cough, because you don't know if it could be, I know a lot of times it could be allergies, it could be other things, but right now they really want to follow the guidance on CDC.
So no cough, even if there's no fever?
Those are the symptoms. Those are the 3 typical symptoms.
Okay.
Yeah.
Good question, Katie. Thank you for sharing.
Thank you, Katie. That was your information.
We have someone who said, as Karen asked, as the state opens up, do you have any recommendations on guidelines for families socializing? So I'm assuming she means that families are socializing like on the weekends, you know, maybe not adhering to those social distancing guidelines.
Yeah. That's something that I actually got to listen to the governor's update today. And I know that's going to be really difficult because everything is really opening up fast. I think almost everything now by June 1st is going to be pretty much open. Even I think in restaurants, if I heard it correctly, that they are able to seat parties of 10, if I'm not mistaken. Did anybody else hear that, or am I imagining things?
But I'm seeing head shakes.
Yeah,
So.
I think I heard it right. So again, we're going to have to, you know, hopefully rely on parents are still in our community, are still doing their due diligence. You know, just can't let our guards down even as things are reopening, you know, to continue to be wearing your mask, using hand sanitizer, washing your hands when you come home from shopping, you know, all those things that we've been doing to hopefully prevent. We just can't say now that everything's open that we're just, you know, everything's going to be fine. We still need to make sure that we're doing our due diligence, and, you know, just asking families to, you know, be conscientious of, you know, who they're around, and, and whatnot. It's hard. It's very hard, but you know, I think we all just have to continue to do our due diligence with that. And some
I
people
think-
probably be comfortable even going out. I know I'm kind of slowly getting myself out, but I'm wearing my mask and whatnot still. So
I think it's
Yeah.
such an individualized question too.
mhm.
You know, I know that we have heard from some home providers that have said, you know, if they know that their parent took a trip for the weekend, then that child, they're having them stay out for 2 weeks because they've been out and about. So that's an individual choice. So that I think it's a great question, Karen, but I do think, you know, if you're having like, how do I specifically do this? Or I would give, you know, I would give your nurse consultant a call and kind of talk through that with them. Because I do know that there are some providers who are choosing one way, and you know, maybe others are okay with it. So it is very individualized.
Right. Yep, and it is a business decision. So yeah, like you said, Tara, that's important. Everybody's policies look a little bit different. So, you know, we just recommend that you follow the CDC's guidance as best as you can. And, you know, that's what IDPH is following too. And one other thing that I wanted to mention too is that I don't know if everybody's aware of it, but there is free legal advice, the hotline for COVID-19 legal advice hotline. And that is available, and that number is, if you want that, in case you have questions on maybe policies, procedures, or you just have a legal question that maybe is affecting you or you had concerns about, I'll give you that number. It's 1-800-332-0419, and they're available from 9 a.m. to 4 p.m. Monday through Friday. And you can access free legal advice through them. A lot, I know, to have a lawyer to look over policies and procedures and whatnot, but this is related to COVID. So this is available. I think it would be a good resource. I know the state used to have a 211 number. I did try to call that today and it said it was no longer in service. So I'm not sure what's going on with that. I know in the past you could call that number and it went right to the state. But I know now it is disconnected, so I'm not sure if people are utilizing that or if they are no longer having that available. But the free legal advice is available, and I thought I'd share that with you in case you have any concerns that you can call them.
Can you say the number again, Kim, and I'll put it in the chat?
Sure. It's 1-800-332-0419.
Karen also asked if there were still guidelines on traveling out of state, and we actually did pose this question to Heidi Hotbed last week, and she said there is no longer a recommendation to self-isolate for 14 days after returning home from travel outside of Iowa and within the United States, as long as the traveler remains well and has not been identified as a close contact of an ill individual. So that's what she responded to that question.
I know some businesses are not allowing their employees to leave. They can't even leave Iowa, you know, so especially in Dubuque, when we live right on the border, some businesses are not allowing that. So some of your families might not be able to leave either, you know, depending on their workplace, if they have policies in place. So I know there's a few employers here locally that aren't allowing them to leave, even to go across to East Dubuque or whatnot. So.
Okay, any questions? I know Esty was just posing a question to providers about masks. If that is something that you are considering in your program, you know, reach out to your CCR&R consultant if you want to talk that through. Obviously, the nurse consultants too. You know, she asked about field trips in the future. So if you have any feedback on any of that, feel free to share. I think a big thing, and Kim hit it a couple times, is this is ever changing for all of us. So I even know, you know, last week we were on with centers and we were on at 1 o'clock in the afternoon, and the governor at 11 had said that all childcare providers and staff could get tested and tests would be available. And so we asked DHS that immediately. And of course they did not have that guidance yet. So we know how quickly things change. And we to my knowledge, we still do not have that guidance. But we do know it was said in her conference or in her daily session last Tuesday, I believe. So it changes, and we are here to provide you with the most updated information we can. Like Kim said, we are going to, if it's a health and safety question or concern, we are going to send you to your nurse consultants, and they are in touch with public health, and that really is where we're getting our information. That is the health department, DHS, and CCR&R. We are partners together in this, and we're working together to make sure that we can get you the best information.
That's one thing we didn't talk about, Kim, that we did talk about in the center session was through the Test Iowa website.
Yes.
And I had filled that out a few weeks ago, and then every week, you get a link to go back on and update your status. And today I answered the questions the same as I have all the other weeks. I don't have any symptoms. As far as I'm aware, I have not been around anyone that had that, but at the end, it did say I was eligible to be tested because anybody can get tested now. So yes, I see Sarah's comment in the chat. Anybody can go through that Test Iowa, but that's not the only way that you can get a test.
Correct.
Right. What I was saying, Sarah, was that last week on the governor's conference, Director Garcia said that all childcare providers would be able to get tested, and we were waiting for guidance on how exactly that was going to happen. They still need to go through Test Iowa. For now, I am happy to hear that from you, Brenda, because I know I heard today that someone else tried and they did not. We're not able to get a test. So that it said it was not available for their zip code, so they didn't get a link to go get one. So I think, go ahead. So I think,
It said I was eligible, but I'm not getting one because I feel like I take it away from somebody who might really need it. So,
I would keep watching for the guidance when that comes out. Like I said, all DHS guidance comes right to your email from CCR&R or DHS, and then it is logged on our website, so you can see that. And I know that our nurse consultants do their very best to update also when health and safety items come out that affect you.
I know too, Brenda, going back to that, it's a really good idea if you can go to the Test Iowa site, but there's only certain test locations. I believe in your area, there's one set up, if I'm not mistaken. I know in Dubuque, we don't have a Test Iowa site. I don't know if they're going to expand that, but I do know locally in Dubuque, we have some initiatives that we're doing too. So, each local area may be doing something different too. So you want to stay in tune with that. Or if you have questions, always contact your local nurse consultant. She may know of there's other avenues. And along, of course, with getting, a hold of your healthcare provider, that would be one of the things that I would really recommend too is contacting your healthcare provider because they can screen you. They know the symptoms and they can recommend you being tested. So again, kind of keeping in touch with your nurse consultant. They might know of other avenues out there to be tested. I know locally we had a community test site that we had. It wasn't through Test Iowa, but we were able to do that. So again, there's other opportunities in each community. So, but that's good to know that, Test Iowa, they are getting a lot more tests. So I think they wanted to do, if I'm not mistaken, I think she said 5,000 a day, I want to say. So we are getting more and more tests daily, and each community may be purchasing their own as well. So that's good to know. One other thing too, talking about just a few other things. If you do decide that you're going to close, make sure that you get in contact with CCR&R and that you also let your DHS consultant know as well. And if you need to discuss anything as far as your closure, you can go ahead and contact your nurse consultants and we can kind of help walk through that guidance document, the health and safety concerns, because that's something that it's a business decision, but sometimes just talking through it might help you decide Yes, I do need to close for a few days, or I need to close down for 14 days versus a couple days. So just to talk through it. So
Thank you so much, Kim. We really appreciate your insight and the information that you shared. So we appreciate it. And like she said, Darla and Monica are on also. So thank you to all our nurse consultants for helping us through this uncharted territory that we're all in. We do appreciate that and appreciate your knowledge and being able to share that with our childcare providers. Well, it looks like we are about done. Once again, I wanted to thank you all for your continued hard work and keeping our children safe and really putting them at the forefront and, you know, staying open or staying ahead of things. I know people had to close but we heard that almost 90% of our childcare providers are going to be able to open back up. And so that is really a wonderful thing for all our families and our children. So whatever piece, a piece where you fit into that, we are very grateful. So please, please, please continue to reach out to CCR&R and we will do our best to help you. So that's all we have for tonight. Well, we appreciate you joining us. Thank you.
thank you, everyone. Good evening.